Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto. If you've attempted weight loss in the past, you may find that it seems to be much more difficult for you to lose weight than it is for some of your friends and family. But why is that? Let's go over 6 things that may be contributing to making your weight loss difficult. 1. Sleep apnea. Sleep apnea is a sleep disorder in which your breathing temporarily stops from time to time in your sleep, resulting in a lack of oxygen getting to your body at night. It can be caused by the structures around your throat closing in certain positions, or just in general while you sleep. Some people feel dazed or groggy or have a headache in the mornings, or sometimes awake in the middle of the night, out of breath and gasping for air. Sleep apnea is a serious medical issue that should be screened for by a sleep study. A lot of research has linked sleep apnea to obesity and weight gain. They feed into each other like a vicious cycle, with obesity worsening sleep apnea, and worsened sleep apnea worsening metabolic syndrome and obesity in general. Seeing your doctor to begin proper management of your sleep apnea by using a CPAP breathing machine or similar device will help start to break this vicious cycle of obesity and obstructive sleep apnea. 2. Thyroid problems. The thyroid produces hormones that are in control of our metabolism. Problems with our thyroid will inevitably cause issues with our metabolism. Having a thyroid that's underactive or hypothyroidism results in a slower metabolism and has people feeling more tired, cold, and depressed, and having muscle cramps and aches. This also results in a significant decrease in physical activity. Hypothyroidism is most commonly associated with weight gain. Having a thyroid that's overactive or hyperthyroidism results in an unusually high metabolism and has people feeling anxious, hot, and nervous, with mood swings and rapid heart palpitations. Although hyperthyroidism is often associated with weight loss, some people with hyperthyroidism end up gaining weight due to the increase in appetite. They just end up eating way more than normal to compensate for their overactive metabolism. It's important to have your thyroid properly screened and any thyroid medications carefully managed by your endocrinologist to ensure thyroid issues won't derail your weight loss protocol. 3. Insulin resistance. After we eat, a hormone called insulin is normally produced by our body. What insulin does is allow the cells in our body to take glucose from our bloodstream and store it or use it. In muscles, it allows them to use this sugar as energy. In fat cells, it allows them to store this sugar as fat. Some people find that their body doesn't respond too well to insulin, and as a result, their body and muscles are not able to get the fuel it needs, so it tries to produce even more insulin to use the glucose. This increase in insulin also forces more of the sugar to be stored as fat, and causes these people to be metabolically inclined to put on more fat than others. Usually this occurs in people with type 2 diabetes. However, it can still be the case for people with insulin resistance or prediabetes. People with diets high in refined carbohydrates have a higher risk of developing insulin resistance. People with metabolic syndrome, such as high blood pressure, high blood sugar, or poor lipid levels, are also at increased risk of insulin resistance. Dealing with these risk factors will be an important part of lowering insulin resistance and preventing your body from storing fat so easily. 4. Certain medications. This could be a whole topic by itself, but to briefly touch on it, some medications are known to cause weight gain as a side effect. This area is a little tricky since a lot of people require the medications and cannot safely stop taking them during their weight loss protocol. For this reason, I generally do not recommend discontinuing them for the sole purpose of losing weight. However, you can have a discussion with your physician to see if it would be possible to slowly reduce and wean off certain medications. For example, a number of antidepressants are known to cause some weight gain, and switching slowly from antidepressants to something like cognitive behavioral therapy or counseling may be helpful to your weight loss journey down the road. Talk to your doctor or clinician about medications if you have concerns about how it might affect your weight. 5. Being overweight in the past. The fat on our body is composed of adipose tissue, also known as fat cells. These fat cells store any extra energy we eat in the form of triglycerides, which is a form of storage fat. You can think of fat cells as little storage bags, and the triglycerides inside as stored fat. When the existing storage bags are full of stored fat, the body needs to create new storage bags, and will both enlarge existing bags and create new storage bags as needed. When the body needs fat to burn, it takes from these storage bags. However, once a storage bag is empty, the body doesn't get rid of it. It simply leaves the empty bag there, keeping it in case it needs to store more fat in the future. It's much easier for your body to refill and store fat if those empty fat cells are already there. It's a lot more difficult to store the fat if the body has to create new fat cells, since it takes time and energy to do so. As a result, individuals who have many more empty fat cells available, like those who were overweight or obese in the past, will put on fat much easier than individuals who don't have many empty fat cells to begin with. These empty fat cells also tend to be larger than normal and are able to carry more fat to begin with. There's no easy way to get rid of those empty fat cells since the body prefers to keep them for as long as possible. However, there are certain cosmetic procedures like liposuction that do help remove them more permanently. 6. Inactive lifestyle. There's a lot of debate around people with slow versus fast metabolisms, and ultimately, while there is a part of our metabolism which is genetic, there is a part of it which is related to our lifestyle. The part you can control is the amount of physical activity you partake in every day. People with more lean muscle mass will burn more energy throughout the day, since muscles take much more energy to maintain than fat. Look to build more lean muscle mass over time, and this will help increase the amount of fat you burn and speed up your metabolism. If you need something more systematic, you can consider a workout routine, maybe something you can do from home or follow along on YouTube. If you can't stand workout routines, you can do something smaller like trying to increase the steps you take per day. Walking to work or using the stairs can be good first steps to increase your physical activity. You can pick up a hobby that's more physical in nature, maybe gardening, walking the dog, or going for walks. Aim to increase your heart rate. The higher your peak heart rate reaches during these activities, the harder you've pushed your body physically, and the harder you push it, the more fat you'll burn, and the faster your metabolism will increase. Metabolic changes usually take time, so don't expect changes right away. Let me know in the comments down below if you face any other challenges yourself, and if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss tips on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know can use the help.